This is Steve Zeltzer with WorkWeek, and I'm talking with Deep Singh, and he is with the Jakara movement, a Central Valley nonprofit representing and supporting the Punjab Sikh community. Welcome to WorkWeek and Pacifica, Deep.
Thank you, Steve. Yeah, glad to be on with you.
Good. So, Deep, why don't you talk about what's been happening? Your community workers are in Central Valley, a large number of them, and there's been a disaster, a catastrophe for workers at the Foster Farm and other factories in Central Valley. So maybe you can talk about what's been going on in Central Valley, the development of COVID, and how you've tried to deal with that to protect your community and family members.
Obviously, there's a larger conversation being had, if not just only in California, throughout the country in terms of our large number of our Latinx community members, our neighbors, our friends, and possibly even family that have been infected, and it's specifically around industries, communities that seem to be most at risk. But in terms of talking to our broader swath of communities here in California, we have definitely seen an increase in the number of COVID infections, especially in the Punjabi Sikh community throughout the Central Valley. Specific to what has started to gain national attention at the Livingston plant of Foster Farms in Merced County, we have been hearing cases, and because the large Punjabi Sikh population that is, that resides in the Central Valley and is, of course, employed at Foster Farms as well, we have been actually trying to ring the alarm bells of what we knew was going to be a ticking time bomb in terms of infections and even mortalities, actually back since March and April of this year. And there was a lot of cases we thought had gone unreported or even underreported. And what we have, seen over the last month, actually, and really during these kind of summer months, specifically at the Livingston plant, really confirmed what we had long suspected, and not only suspected, what we knew, speaking specifically to workers who are oftentimes members of our own family.
And you say that you were concerned in March and April about the danger of this COVID-19 virus contaminating these plants. What did you do, and who did you contact and try to get some response?
So initially, we really, right away when we were hearing about the virus, and even before things began exactly even shutting down, many of us have family members, if not are the children of workers at many of the Foster Farm plants throughout the Central Valley. And specific to Foster Farms, there are 4 major plant complexes, 2 in Fresno County, 1 in Stanislaus County, and the one that's been most discussed about recently, which is the Livingston plant in Merced County. We were talking to workers, like I said, oftentimes our own parents, sometimes our family members, sometimes our brothers and sisters, what they were feeling, what were some of their anxieties, what were questions as we were beginning to get CDC guidelines and best practices, what was happening, and oftentimes what was not happening at the plants. And so it was really just collecting that data and really these comments from workers themselves, or sometimes from their children who would be willing to amplify some of their concerns in ways that sometimes even the parents would not. Putting that together, we sent a series of a couple letters directly to Foster Farms. In fact, we dropped them off in multiple factories of theirs across Central Valley. We had some response, we had some conversations, but at an early point, it really was, I don't think they really understood how important this was, nor do I think that they were really as concerned as they probably should have been about to safeguard the safety and rights of their workers. Since then, it's really been talking to different state agencies, local agencies, and even the media, and anyone that's willing to listen, so that we can make sure that these stories are lifted, amplified, and needed attention and hopefully remedy is brought about quickly.
Now, there is supposed to be protection of workers from Cal-OSHA, which is supposed to protect workers in factories. What was your experience with Cal-OSHA?
We've had certain conversations with Cal-OSHA. Cal-OSHA has made numerous visits specifically to that plant, as well as other sites throughout the Central Valley. And I think if I can just share a note even about the Jakara movement, we work in 12 counties across California, really in the Central Valley, from Kern County up to Sutter, north of Sacramento, as well as the Bay Area, and especially Alameda and Santa Clara counties. So in terms of working specifically in the Punjabi Sikh community, this is a large, sizable community in the sense that the Punjabi is one of the top 10 most spoken languages in the state, and the third most spoken after English and Spanish in the Central Valley. We were but in a community that does not have a large ecosystem of CBOs or nonprofits that work in it. Many families and parents have been raising alarm bells with us about a number of different industries. So I'm talking, all the way from Arvin, south of Bakersfield, to Live Oak, north of Yuba City, about canneries, about food production centers, about different plants and different concerns. So we've been trying to raise these with Cal-OSHA as much as possible. Again, bringing it back to the Livingston plant, they had made a series of visits. They had expressed their grave concerns, but I think there is a kind of understanding sort of that balance that Cal-OSHA is not staffed in any way in terms of the way that it needs to be to have a robust engagement with employers to make sure that the safety and rights of the workers are being protected. And on the flip side, I think there is a certain sort of conservative bias within many of these agencies, which is to attempt to give employers second, third, fourth, fifth, sixth, and seventh sometimes chances, but because there's not a desire to intercede in any kind of in any robust way. But sometimes what that does is it, in hopes of getting an employer to remedy, you're also assuming that the employer is acting in good faith, and sometimes that may or may not be true.
And you say that the agency is understaffed. I mean, this pandemic has been going on for months now. I mean, since March and April. Why isn't the agency fully staffed? And have you contacted Governor Newsom, who is in charge of making sure that the agencies are doing their jobs?
So we have definitely lifted some of our concerns with Governor Newsom's strike teams that have visited the Central Valley. Initially Cal-OSHA wasn't even going out to make site visits during the first couple months of the pandemic. They were reliant on people giving calls, but they were not making site visits themselves to be able to confirm them. So I think that was a vitally misstep, because essential workers were still being called to go into those plants, but Cal-OSHA was not sending out people to actually investigate what was occurring there. And
were there workers who were sick and then still being coerced to continue to go to work at the Foster Farm plant?
Sorry, Steve, could you repeat the question?
Yeah, were there workers who were sick and then continuing to be coerced to go into work even though they were sick?
Very, very much so, and especially when you have a size of that many people working that close together, that concentration and that density, oftentimes shoulder to shoulder. You cannot keep production levels at the meat packing houses as the industry has done, and then create social distancing. It's not possible at those production levels. And I think that is a moral question that has to be asked. And I think people have attempted different things. So for instance, even the Foster Farms plant engaged in as they shared, a deep cleaning that Merced County Public Health allowed them to do so that they could reopen as one of the criteria. But the problem for me is, we know, it's one thing if we were talking in March and April where we didn't understand completely the transmission of this virus. This virus, it's not so much surface to surface. It's not so much about deep cleaning anymore. It's really about the major vector being through the respiratory system. It's really about having high concentrations, large density of people together. That's what actually creates the spread. And so more often than not, these things just become sort of window dressing and not address the real root issue.
And the people in the community who were contacting you, workers, their families, their children, what were they saying to you? I mean, the fear of being contaminated must have been very traumatic.
Oh, absolutely. Sometimes, so we work in over 70 high schools across the state and about 15 UCs and CSU campuses as well. So sometimes it would be, can you talk to our parents directly? Sometimes they listen to you more than they'll listen to us. Sometimes it was just cries for help. Sometimes it was, we were going on to Punjabi radio and sharing about sort of what your rights are. And part of your rights are to have a safe work environment. And a lot of people were kind of calling, sharing, and while our work was, of course, initially concentrated in the Punjabi Sikh community, we started getting calls and people reaching out to us from, our brothers and sisters and our neighbors and our community members in Latinx and communities in Hmong communities and many of the other communities that live here in the Central Valley.
And I understand the mayor of Livingston, there's been some views that, in fact, they should ignore these regulations. In fact, I understand Governor Newsom put some restrictions on their budget money because they were saying that they weren't going to abide by the guidelines even of CDC. Is that the case in Central Valley?
It's an extremely fluid situation, even there. I think, where we have rhetorically seen Governor Newsom stand for the community, and we have actually seen him put financial resources. But what we have not seen is a robust enforcement regime and one that could actually take actual stern action against these. So we're seeing part of the equation oftentimes from the governor's office, but we haven't seen the full picture yet. That is really what's actually necessary.
And there is a union, the United Farm Workers Union. You were on a panel recently with a representative. What was the role of the union, and what was their effort at the plant, as far as you know?
So the foster farms plants throughout the valley actually oftentimes have different union representing them. At the largest part of the Livingston plant is represented by the United Farm Workers, and they have raised concerns, and they have raised the issue that they may issue a boycott of foster farms. They have not done so yet, but they have raised the issue that is something they're considering.
And the company, were saying earlier, a lot of people hoped that the company would do the right thing and would protect the workers and had the workers' interest in mind. You now believe that was not the case?
I believe that the company could have done much, much more, and I don't believe that they that centering the protection of the workers has been the number one concern of the company. Absolutely.
And the workers that have gotten sick at the plant that you've been in touch with, have they been able to get workers' comp? Have they been able to get their health concerns taken care of? A lot of workers are afraid they'll lose their health care if they lose their job. What is the situation with the workers who get sick or can't work? Are they getting taken care of?
Oftentimes not. The information is not going down to the workers on the line. Many have been told that they had to use their sick leave, even though Governor Newsom had signed certain authorization to allow people to take that leave to recover, but instead they're being forced to use their sick leave. So I think there's a lot of information that is not getting down to the level of the line worker. Oftentimes they're monolingual Punjabi speakers, Spanish speakers, Hmong speakers, and I think to really understand this particular industry at this time and place, it takes a much more robust effort. You can't just do sort of what you usually have been doing, which even in the best case is never good enough, and much less during the period of a pandemic.
And these factories are large. One of the factories in Livingston, 2,900 workers. It sounds from what you're saying that proper physical distancing is not taking place in the plants. What do you see the solution to this pandemic, which is likely to continue for months and maybe into next year?
I think that the workers have to be asked. The workers have many ideas of how social distancing can be applied, and many have raised the issue that you'll not be able to have the same line production speed if you're going to actually create a safe working environment. And so I think everything has to be on the table. All ideas and workers need to be listened to think of creative ways that put worker safety first.
And President Trump has said that keeping these plants open is a priority, but he hasn't required that they abide by health and safety, Cal-OSHA. What do you think about that idea that workers should be going into these plants, required to go, and the plants should continue to operate, yet the requirements of OSHA and Cal-OSHA are not being abided by as a law?
I think, sometimes the less said is better, but it's an absolute travesty that we have an administration that is ignorant about the issue and somehow celebrates itself in being ignorant about the issue, because oftentimes the hue and cry was raised that the meat production levels to keep the number of workers there was required for the domestic market in terms of the food security of the United States, and that is absolutely false. Most of the meat, well, actually I won't say most, but a large percentage of the meat is shipped overseas, as is many other things in the country. So sometimes under the cry of sort of security and self-defense, defense of the security of this country, a lot of horrible things are happening to the workers and the domestic residents and citizens of this community.
And these are frontline workers. Do you think that systemic racism has played any part in the fact that these workers haven't been properly taken care of and protected?
I definitely believe that. There are systemic issues around racism, around classism, a number of different isms that we could discuss. The racism is definitely part of one of them in terms of who are the frontline workers, whose lives are essential, and as one worker shared with me, it puts not just, they call us essential, but they treat us as we're expendable.
And this recognition that workers are dying and they continue to get sick, do you think there's going to be a political change in consciousness and an organization of the workers in these factories?
Of course, that's our hope, is that through understanding their rights, understanding their power, understanding their voice, that new horizons, new hopes, and new possibilities are going to be possible.
Okay, well, thank you for joining us on WorkWeek and on Pacifica, and we've been talking with Namedeep Singh, and he is with the Jakara movement, and which is fighting to protect workers and get information out to workers and their families and their communities. So hope this struggle is successful, because it seems like it is a matter of life and death for people.
Absolutely. I mean, I'm hoping in the upcoming months or weeks, Steve, I can be back on and present some better news.
Okay. Well, thanks a lot.